Here's today's MercyOne Genesis Medical Moments.
And we are continuing our conversation about diabetes with Dr. Salem Gaballa. And we talked briefly earlier about type 1 and type 2 diabetes. Can you talk to us a little bit more about the differences between the two?
Yes, so we have a very important hormone called insulin produced from beta cell of the pancreas. The insulin allows the cells utilize the blood sugar. In type 1, the autoimmune disease attack the cells, so it causes production of little to none of insulin, causing insulin deficiency, and the end result is hyperglycemia. That usually happen early in life, and we used to call it juvenile diabetes, but it can happen later in life, and now we call it late autoimmune diabetes of the adult. Versus type 2, which is caused by insulin resistance. The body are able to produce insulin, sometimes even too much insulin, because of the underlying resistance from the obesity, poor diet, and physical inactivity.
So how does someone know if they have type 1 or type 2 diabetes? What are some of the symptoms?
The symptoms are very common for both. So the general will be generalized fatigue, lethargy, and some nausea, some vomiting, blurry visions, sometimes unintentional weight loss. Most of the type 1 diabetes will be, at the diagnosis, will have unintentional weight loss and will be admitted with a diabetic ketoacidosis from insulin deficiency. And we can differentiate between both types by doing a blood test to evaluate the pancreatic reserve and the autoimmunity, which is very unique for the type 1 diabetes, would have autoimmunity with low pancreatic reserve versus type 2 would have no autoimmunity and too much insulin.
Okay. So what are some of the risk factors that increase maybe that likelihood of getting diabetes? Because you talked a little bit about obesity, right?
Yes, that's correct. So the risk factor generally will depend on the subtypes. Type 2 will be obesity, poor diet, sedentary lifestyle, and also genetic factors or family history. Type 1, it has a major part of genetic factors.
Okay, so family history does play a part in this then?
It does play a major part, yes, in both type 1 and type 2 and other subtypes of diabetes such as monogenic diabetes or atypical diabetes.
Okay, what can someone do to reduce the risk of diabetes? Get up and move, right?
Absolutely. A comprehensive lifestyle modification, maintaining a healthy weight, eating a healthy balanced diet, exercising at least 30 minutes per day or 150 minutes per week, losing 5 to 10% weight loss, that can cause also reduce the risk of diabetes. Regular checks with your primary care doctor also can diagnose diabetes very early and kind of treat it.
Okay, and how is diabetes diagnosed? Is it just a blood test?
We can diagnose diabetes, yes, by different ways. The most commonly way we use hemoglobin A1C, which is a blood test. We'll get the result within a couple minutes. And a number over 6.5 is suggestive of type 2 diabetes. But other ways will be a fasting blood sugar over 126 or a random blood sugar over 200 or an oral glucose tolerance test. 2 hours over 200, that's diagnostic of diabetes.
Okay, so after someone is diagnosed, what would be the next steps for them?
The next steps, obviously, with conversation with the regular doctors, will be a comprehensive lifestyle modifications. And obviously, we do have medication that can help with the diabetes, depending on the subtypes of diabetes. Type 2, we have oral agents. We have injectable once a week. We have, nowadays for type 1, we have different subtypes of insulins. We do have a lot of technology, the CGMs, the insulin pumps. So we do have a lot of options for both types.
How manageable is diabetes once you've been diagnosed?
Nowadays in 2024, it's very well manageable with the technologies that we do have for both types of type 1. We do have very advanced fully automatic pumps that can help type 1 to elevate the struggle with that and get the diabetes very well controlled. And as a type 2, we do have a lot of medication that can help with weight loss and diabetes at the same time. And we do have newer agents as well, like SGLT2 inhibitors, very effective for diabetes for folks that have an underlying kidney disease or heart disease.
Okay, well, some good information you shared with us, Doctor. Thank you so much for taking the time to talk to us.
Thank you. Welcome.
And this was your MercyOne Genesis Medical Moments. And for more information, go to ourquadcities.com and click on the medical tab.